Dr. Guy with Project Wellness Company, and one thing that a lot of times patients will come in would be like numbness and tingling down in their hands. They may have gotten a diagnosis for carpal tunnel. And so when somebody's coming in for us with complaining about numbness and tingling in their hands, if they have or have not gotten a diagnosis on carpal tunnel, we want to evaluate the muscles that ultimately are controlling those hands. So when I wiggle my fingers, the muscles that are allowing me to do that are coming out of my forearm up and around the elbow here. And so you've probably heard of like lateral epicondylitis or medial epicondylitis, which would essentially be like golfer's elbow or tennis elbow. Okay. Those muscles are going to lie on the inside or the outside of that arm, just depending on which one is having that issue. And so a lot of times when there's numbness and tingling down here, we could have specifically a wrist issue, putting pressure on those nerves. And if that's the case, all too often we're going to have really tight muscles up and through here on our forearms, just due to the fact that a lot of us spend plenty of time looking down at our cell phones, using our thumbs to type, or else on a computer, constantly using that. And if we don't have good posture while doing those things, it can start to lead to issues further up. And so what I like to do is we're going to evaluate first, for me, is to see exactly if we have muscles involvement. And so what I'll have Dr. Bailey do is we're going to bring her arm up into this position, and what I want her to do is just circle her hand. And while she's doing that, I'm going to contact those muscles up at the top here, and then I'll have her switch directions, and you'll notice by her facial expressions here, it's a little bit tender up and through there, okay? And so we're going to contact those specific spots, essentially right around the radial head here, which kind of sits right underneath my thumb, allowing her movement in that wrist down and through there. And then we're going to contact right over top of that radial head. I'm going to have her circle again, and it's nice and tight in through there, okay? And what we want to do is we want to loosen those up, because ultimately, switch directions, ultimately she's having those wrist issues, okay? If we have involvement of these muscles up and through here that are really, really tight, it's going to affect things down and through here. It can be inflammation issues down and through there. And so loosening these muscles up and through here before I adjust down here is just going to allow the adjustment to be more successful and allow us to get the correct alignment down in that wrist, ultimately taking pressure off of that and getting some of that numbness and tingling to go away if it's a wrist issue, as opposed to a cervical issue causing that numbness and tingling down into her hands. And so in order to adjust that wrist, she's got 8 little bones in this small little circle, essentially kind of right behind her watch here. And so those bones can subluxate the same way that the spine can subluxate, and they're going to move out of position. And so what we want to do is we want to motion those bones, checking them to see if we have any specific bone within that wrist that's causing an issue. And then once I identify the bone that's having the issue, we're going to come in here and we're going to adjust it. We're going to set those bones back in place, traction that wrist out a little bit, just making sure that everything's sitting back into the correct position, which then will ultimately allow us to get pressure off the nerves. And then for our at-home stuff, okay, I want her to start working on loosening these muscles up if we found that they're tight, because they're going to be a contributing factor as to why she's having the wrist issues. And so I'll send her home with specific things that she can be doing in order to stretch and loosen these muscles up that are all adhesed and tight and stiff, which if she can work on that at home on a daily basis, we're going to get better results faster to clear up the carpal tunnel type issues that she's having or elbow issues that she's having due to the muscular issue up here at the elbow.